Okay, so let's start today's lecture. So today we is our last lecture. So we would be talking about the eye problem. Okay, so the first one is a case. Mr. Wang's wife came into the pharmacy and saying she feel gritty in the eye. She feel gritty and dry for both eyes. And ask if we can recommend any eye drop 所以是老王的太太，她最近有眼睛是干干的，然后涩涩的，还有流老把油啊，所以问我们药吃可不可以介绍什么药或者是药水。So for the dry eye, yeah, what sort of question would you ask? So if anyone come in the pharmacy saying is not feeling well with for the eye, so we have to find out, is it just pure dry eye or there's something more severe issue behind? Okay, of course we have to ask what kind of question. What medication are they taking? Yeah, because some medication can cause dry eye. For example, the anticholinergic. Yeah, we know all the anticholinergic can cause dry eyes, dry mouth. Yeah, anything like dry. So definitely, medication can make the dry eye like getting worse. Or people taking diuretic or even steroid. Okay, they can contribute to the dry eye. And the second question, we want to find out, do they wear contact lenses? Yeah, because some eye drops got actually, I would say most of the eye drop, the thing, they got a preservative. So when we try to recommend anything, the preservative um, will attach to the contact lenses. Okay, that might damage the contact lenses. So we have to make sure they wear contact. And also when you have any eye issue like dry eye, even for eye infection, um, contact we better advise them don't wear any contacts because contact lenses can make the issue worse. Yeah. And if they wear contacts, we probably sometimes we have to check, do they keep their contact lens in a clean? Do they clean the contact lenses good? Well, yeah. And how about their hygiene, the ocular hygiene? Yeah. And because the preservative, so when someone is using contact lens, sometimes we have to use or choose the preservative-free eye drop. So normally preservative-free eye drop is the single vial eye drop. Yeah, because the single vial, once you open it, is only used for 1 or 2 days. So they don't need to put any preservative in it. But anything like comes in a bottle of like 10 mil, 20 mil, 30 mil, yeah, definitely they have to put a preservative. Yeah. But when you dispense any or give it out any eye drop, you have to tell them once they open the eye drop is only good for 30 days. So after 30 days, they have to throw the eye drop, throw it out. Don't use it after one month. Okay, and we also need to know whether they had pain or any vision change, or do they feel anything inside the eyes like foreign body? Yeah, because that might indicate the patient have glaucoma, iritis, or any cornea ulcer. Yeah. Because for glaucoma and it can be very painful, or iritis as well. Yeah. And we have to check, see whether they have any pus or discharge from the eye. Yeah, because if the discharge is watery, normally we would suspect is a virus infection. But if the discharge is the color looks a bit creamy or yellowish, yeah, we normally will suspect that is bacterial infection. But in the community pharmacy in Taiwan, uh, pharmacists or pharmacy, you can't recommend any eye drop or eye ointment with antibiotic. So in this part, you just have to um, when you ask the question for anyone have bacterial or even the watery discharge, which sometimes might indicate to virus issue, you need to refer to the doctor. And also people have diabetes or any allergy or arthritis, or sometimes they could cause the dry eye. There's a syndrome called Sjogren syndrome. So what is Sjogren syndrome? Sjogren syndrome um, is an autoimmune issue, autoimmune problem, can cause a lot of dry because your immunity is attacking the mucosa area like your eye, your joint. So you have dry eye, or sometimes they have the arthritis, which is like joint pain. And also, is it only one eye affected? Normally, when anyone come into the pharmacy, um, do you reckon one eye is more severe or two eye affected is more severe? 所以我这边要问一个问题：如果有一个病人他来到药局说他有一个眼睛影响，他一个眼睛现在有问题，那另外一个跟进来说是两个眼睛有问题，你觉得哪一个比较严重？Yeah. One eye affected, is it more severe or two eye affected? Yeah.
两个眼睛都不舒服的吗？
你说
因为
好
因为感觉已经被传染了，所以两个眼睛都不舒服，会比较严重。
，Okay. So how about Shabir? What do you reckon? Which one is more severe? Which one you normally we in the pharmacy we will defer or refer to the doctor. One eye or two eye affected. 玉芬，你觉得呢？一个眼睛比较严重，还是两个眼睛有问题？
嗯感觉像是两个眼睛，可是我刚才想到，如果一个眼睛感染，那它可能会有其他的原因，因为如果是过敏的话，那就应该是两个眼睛是同时；如果是感染的话，两个眼睛应该会互相传染才对啊。可是如果只有
嗯哼，
单一个眼睛的话，好像以我现在的知识，我没办法判定它是怎么样的，就
对，
是
没
对。
没有错。所以呢，one eye affected is more like troublesome. 所以如果今天一个眼睛有影响到的话，其实这个来说，对药师来说是，其实这个 case 基本上是最好是要把它转给医生，因为 if one eye affected, normally what would be the cause? infection, right? Or glaucoma, because sometimes can be one eye. But how about two eye affected? Normally, when you have two eye affected, normally it's caused by what? Dry eye, right? Dry eyes, 干眼症 or is an allergy. So if that is caused by dry eye or allergy, normally it's two eye. 所以 two eye is safer, yeah, in terms of the the reason behind. Normally, if you see a patient like coming with a two eye affected, it's more safe. Okay, so we have to ask the question, yeah, is it one eye affected? Yeah, because one eye affected sometimes can be iritis. 这个你的虹膜发炎，虹膜发炎也是一个很严重的问题，所以它有时候不是只有两眼，它有时候是只有一个眼睛，yeah, and can be very painful. And also bacteria or virus conjunctivitis, sometimes normally when they started with one eye and then pass to the other eye, okay? Or you can see there's a red eye, persistent red eye in only one side. Yeah, that is more severe. Yeah, so more troublesome. So if you see one eye affected, consider to refer to the doctor. Okay, so what causes dry eye? Yeah, the first one is like 50 years old above. Yeah, because when when people get older, they have problem to produce the lubricant tear, or people have menopausal, yeah, or post menopause, or they stay in the aircon, or it's a old windy day, or they've been studying, reading for a long time, or do they wear contact lenses, or Sjogren syndrome, yeah. Normally you will notice for people have Sjogren syndrome, they have also rheumatoid arthritis as well, because it's immunity issue. So look at the the right hand side, the first eye drop, yeah, here, or optic, this is a single, it's like a box of 50 ml. Normally that eye drop has preservative. And the bottom one is a single vial. Because it comes in a single vial, you don't need to put a preservative in it. So it can be suitable for people wear contact lenses, or some people their eye is a bit sensitive to the preservative. Then you can recommend this single vial. Okay. What is Sjogren syndrome? Okay, we know it's an autoimmune disease, and it affects the eye or your salivary gland or other parts of the body. And also because the immune system will attack the tear and the salivary gland, so that's why it causes the dry eye or even dry mouth. Because it's autoimmune problem, so we can't do anything about it. So we can only this syndrome can be only managed by some artificial tear or saliva or artificial saliva mouthwash, or even just use lozenge to keep your mouth moisture. Okay, so this is diagram for the Sjogren syndrome. 也这个图你们就看一下，就是有关于 Sjogren syndrome 的一些症状啊。Okay, so for the what is tear? What is tear? So your eye produced tear. normally it will consist of 3 layers. So from the outer layer to the inner layer.所以它从外到内呢是有一个脂质层 lipid layer and aqueous layer and mucosa layer， 所以它是正常的。So that's the structure for your lubricant tear， 就是我们眼睛所分泌的这些泪液呢，它正常是会在眼睛表层形成这样子的一个结构。So the lipid layer will prevent the water or the moisture to evaporate from the eye drop. So that's why we'll keep your eye lubricant and the moisture for a long time. But sometimes when people getting older, their eye don't produce a good quality of the tear. So that's why the tear that produce is not tear because it's not protecting the eye. So that's why some people come into the pharmacy and just complain about their eyes is gritty, it feel dry, but you can see the eye is watery 所以说有些人呢，他们有干眼症，所以他们虽然有那个症状，可是你看他的眼睛都是在流目油，那你会想说，为什么流目油？眼睛应该有很多的泪液啊，为什么还是干呢？那是因为他们所制造出来这些泪液呢，它并不具有润滑的作用，或不具有保护的作用。所以说这个时候我们还是需要用一些人工泪液来帮助这些有干眼症的这些症状的人。Okay, the second case is regarding a conjunctivitis. 就是我们说的结膜炎。So Mr. Wang's son woke up in the morning and just found his right eye was sticky and there was yellowish discharge. 所以说有 conjunctivitis 的人呢，他们早上通常这个问题都是一早醒来，一个眼睛先是一个眼睛会黏黏的，然后有一点黄黄的青色的分泌物，他们眼睛有时候他会跟你形容就是黏住了所以眼睛也是有一点点不舒服像这种情况，根据他的描述。If they say there's a bit sticky for the eye and also yellowish discharge, so 95% you can say this is a bacterial conjunctivitis. 所以这种细菌性的结膜炎，当然我们就是会给这些 antibiotic. We will offer them the bacterial, so antibiotic eye drop. So in Australian pharmacy, pharmacists can give it out, the antibiotic eye drop without a prescription. So a lot of people, they will come in to, if they have any conjunctivitis. 好，那这一张图呢，就是为了让你们分辨这两个不同，就是一个叫做结膜，一个叫做角膜。结膜就是我们的所谓的 conjunctiva， 然后角膜呢又叫做 cornea， 所以 cornea 我们看看就是基本上就是个表面的这个部分 ，is the surface of the eye， yeah, exposed on the outside， 这个是属于 cornea。但是结膜呢，结膜就是这些红色的这个部分，看到了没有？这个红色的这个部分。黏膜的位置，这个地方就是所谓的结膜。所以说角膜炎跟结膜炎这两个是不一样的地方。Okay, so that's the structure for the cornea. This is cornea. Cornea is mean this area. But for conjunctiva is those red area. So they are talking about different area. Conjunctivitis normally there's 3 different type. Can be bacterial, or can be viral, or can caused by allergy. Yeah. So normally for bacterial conjunctivitis, the symptom normally is slightly a bit painful, or我们叫做 gritty。gritty 就是说你的眼睛好像感觉有一点这种沙粒状这种，然后 normally the eye will be like red with yellowish discharge. Those infection normally begins in one eye, then pass to the other eye after 1 or 2 days. And normally it's not severe, it's just a mild symptom. And normally it will clear up in about under 5 days. So you don't have to 在台湾的药局呢，其实病人如果有这种问题的话，有时候你不一定要给这种抗生素的眼药水，其实你用那个生理食盐水呢去冲一冲，尤其是有一些小孩子你就跟他其实用那个生理食盐水去好好的去做清洗，这些症状他有时候都会自己好起来。但是so in the pharmacy, sometimes you don't need to recommend any antibiotic eye drop. You can just only offer the normal saline eye drop or wash to clean the eyes. The problem normally will resolve in 5 days. Yeah, but you just have to tell the patient after using normal saline, like in 2 days, nothing improving, see the doctor. Yeah. So you will also see very thick and yellowish discharge, or sometimes it's not yellowish, can be just white color. And people's eye can be sensitive to the sunlight, and it's also contagious because it's bacterial infection. And normally happen in children is more than in adult. Okay, so normally antibiotic eye drop or ointment can be offered to help. And viral conjunctivitis, yeah, why there will be viral conjunctivitis? Yeah, because sometimes when people have cold or flu, is causing by the virus. After couple of days, some people might have that sort of conjunctivitis, but normally that conjunctivitis is caused by the virus, and also it's begin with one eye, then pass to the other eye. And normally the discharge is watery. It's not yellowish because it's not bacteria, and it's highly contagious, definitely. And it will clear up by itself. If you don't do anything, it normally will clear in 1 or 2 weeks. 所以这种病毒性的这种角膜炎呢，不是角膜炎，结膜炎，它通常如果你不去做处理，有时候1到2个礼拜它也是会好。所以说你作为药师，你大概要知道这些病这些原因是什么。那既然如果你推荐了一些，你就说因为你病人可能如果没有办法很快去看到这个眼科医生，你可以请他用这个生理食盐水去冲一冲但是你要跟他说，就是 if you offer the any treatment like normal saline, but the problem is not solving in 1 or 2 days, they need to see the doctor. OK， 那第3种就是有关这种 conjunctivitis, but it's caused by the allergy. So normally symptom you will come with intense itchy. 所以如果是过敏性的这种角膜炎的话，它通常是非常痒而且也是有红的眼睛，但是你可以看到是2个眼睛，因为它是过敏的所以 the discharge can be you just like a bit watery or white discharge. 然后它的那个，因为你一直去揉眼睛，所以很痒，所以通常 you will see a swollen eyelid， 所以它的眼球这个眼睑位置可能都会好像肿起来这样子。 Okay, conjunctivitis. Just like I say, we can recommend normal saline irrigation, or we can offer antibiotic eye drop or ointment. Yeah. If still not helping, then you have to refer. In Taiwan, definitely you can't offer them any antibiotic eye drop or eye ointment. So you have to refer to the doctor. And after you offer them, yeah, those eye drop or eye ointment, you have to explain how to use it. Okay, and they can't wear any contacts. So you have to ask them, don't wear contacts when you use those eye drop. And not helping for 2 days, see the doctor. Okay, so that this slide is mentioned. This is conjunctivitis, and this is cornealitis. 一个是角膜，一个是结膜炎，所以你们自己可以看一下。You can have a look. Yeah. The other one is called stye. 就是我们所谓的针眼，长针眼。所以长针眼基本上 is a bacterial infection. Okay. And normally you can also use the normal saline irrigation or even use hot towel compression. 所以 hot towel compression 就是说你用热毛巾，就是说治疗的方法，你除了这些抗生素的眼药水或者眼药膏以外，生理食盐水，或者是你叫他用热毛巾去敷眼睛。The purpose of using hot towel compression is because hot towel can increase the circulation in the area, so that will make it easy to the disease to heal itself. 所以说，我们热毛巾有时候可以加快那个血液循环，所以有时候会自己那些眼睛的问题会缩短它的整个疾病的过程。Okay, so we have to tell the patient how to use eye drop properly. Yeah, the first you have to wash hand, and also eye drop you have to ask them to tilt your head back. 就是他们的眼睛要可能看天花板look upward， 然后while eye open and gently pull down the lower eyelid， 所以他们看这个天花板的时候，把眼睑呢把它拉出一个小角，就形成一个好像小口袋一样，然后就把眼药水或者是眼药膏直接滴进去Okay, and try to avoid any tip of the dropper to touch the eye or eyelash， 因为这样的话你会去污染到那个眼药水然后 then 在眼药水点完 after you put the eye drop in, they close the eye and blink your eye for couple of time. And that will help the eye drop to spray into the whole eye. And sometimes you have to press the finger at the corner, in the corner of the eye, because here there's a tear duct. So if you press the tear duct, that can avoid some eye drop to pass into the nose. 所以说在这个眼睛的角落有一个所谓的鼻泪管吧，所以你把这个鼻泪管让他们按住它，有时候有一些药水是苦苦的，所以如果你没有把它按住的话，它会透过这个鼻泪管呢跑到你的口腔里面，它就会觉得有点苦苦的。Okay, so this is also the diagram to show how to use or administer the eye drop. Yeah. And also how to use the ointment. 所以你们可以自己看一下。But when you recommend any eye ointment, you have to advise the patient the ointment can cause the vision can blur the vision. 所以眼药膏呢会让他们点完以后，他们的那个视觉会有时候有一点点模糊，所以你可能要告知病人，如果有受到影响的话，就是不要去开车。 Okay, we finished the eye drop. 有没有问题？
Professor,
Okay.
Professor, this conjunctivitis is for how long?